because we know that in other, and why is that so? Is because we know that in order for us to have patient-centered care or even patient-centered treatment therapies, it is important that the data that is used is applicable to all population, which means that the data to all populations need to be contributing to all of the data that we're using in creating or crafting medical therapies or technologies that we're seeing right now. And when I mean diversity, I'm talking about the fact that we need to mirror both our biological and non-biological variations. And some of the non-biological variations would be kind of the environments that we live in. In Nigeria, for example, what our health system looks like, what accessibility to healthcare looks like. All that needs to be considered because we need to understand the context with which the data that we're generating to produce or give recommendation that it truly represents the entire population. Despite the fact that pharmaceutical companies understand this, there is also a requirement. It's almost like saying, well, if we want to bring data or clinical research to Nigeria, for example, what is Nigeria currently doing to make sure that there's a breeding ground for us to actually be able to go in there? Is there the capacity to conduct clinical research trials in Nigeria? So, in as much as there's a required increased effort from government, there also has to be policies in place, which right now I can't address the policies in Nigeria, but also, and that is where the student and the academic institutions come in, because if the academic institution and students like the MSc and the doctoral students are able to contribute or understand the fact that we need to contribute to data and that we're contributing to the data in a way that is high quality data, because as we know, just contributing or gathering data is not enough. It has to be a data that is of high quality for us to actually know that we're contributing and that we're moving the clinical research as well as the body of knowledge forward. I know when we started this presentation, Dr. C touched on, kind of all of the theories that we've heard about in books that are coming up next for some of the webinars, but they are where they are now because they were able to meaningfully contribute to the data that we currently have. And I'll touch base just to give us a little bit idea on how we can do that, and particularly for the students, and how the professors on the call can also guide and support and mentor students in achieving that goal. Going to the next slide. And like I said, student and evidence generation, it starts with the student on this call and your friends. It starts with you and your thesis. When I did my bachelor's degree in nursing in Nigeria at Babcock University, there's a requirement for us to do some sort of clinical research. I can't even remember what my topic was, but I knew it was something along the lines of knowledge, attitude, and practice of some sort. Did I ever publish that paper? No. Do I believe, me looking back now, do I believe that was of high quality? A capital no. I don't think I will have contributed or moved the body of knowledge forward with what I did. And I want to make sure that the people on the call today do not fall into that same trap. And kind of, first of all, start by highlighting how you can contribute, the importance of contributing quality data. In a subsequent slide, I'll be going through how you can do that, how probably myself and Dr. C and the resources that he has, how we can support that. Of course, why is it important? You're contributing to the body of knowledge. You want to make sure that you're also a key opinion leader. There's always the reward and recognition both to the students and the institutions. For example, depending on what school you're in, that you will be creating and contributing to that data, you bring recognition to yourself as well as to the institution where you are. It also prepares to position yourself as an expert in the field, depending on what your research interest is. The cool part of it, which I think is really important, and that's why a lot of us are in nursing, is because it helps to improve the health care of our patients. Because we know that by giving patients access to some of these clinical trials, by giving them access to some of the innovations that I know is birthing between us, we can have the opportunity to improve healthcare for our patients, which is paramount to why we're nurses. It also leverages us we have unique access that, in my opinion, we're currently not utilizing. And you might hear me mention Babcock University for some time. That's because, that's my alma mater. That's where I did my bachelor's degree in nursing. It's of no means trying to say that other institutions are not as great as Babcock University. It's just the first university that comes to my mind when I'm talking about Nigeria and nursing. Um, but if we are looking at it from the perspective, for example, most of your universities will have teaching hospitals. you have a unique access to those teaching hospitals. You have a unique access to patient population that represent diversity, what everyone is looking for right now to generate data, to generate clinical treatments, therapies, and medical technology. You have that unique access to them that someone, for example, where I am right now, I would not have direct access to those patients that you have that will mirror the biological and non-biological variations that we want to see in the data and treatment that we're seeing. There's also access to disease of increased incidence. We might think, well, maybe we don't have the same disease like in the high income countries. I'm here to tell you that's not true. Cancer, for example, cardiovascular disease, diabetes, hypertension. There's I in Nigeria and other low income countries, as is I in other high income countries. And there is constantly a need to keep revamping, to keep revising the current treatments that we have and how we can have even better treatment for some of this condition. And guess what? Nigeria as a country has a high rate of some of those disease incidents that gives us, it's a new perspective that we have to this kind of patient population that is currently untapped right now. And it gives us also the unique patient experience in terms of what is the living experience, of those patients that we will be addressing, even as we begin to conduct clinical trials or even begin to think about how our thesis can move and contribute to the body of knowledge that we currently have right now. I'm going to the next stage. Again, feel free to stop me for any question. And just to kind of piggyback a little bit, so this is Joanna Briggs' model of evidence-based healthcare. And if you see each of this pie, each of this pie of the big pie, you would see where healthcare evidence generation comes into place. And at the center of it all is the evidence-based practice. And that's really talking about what evidence are we generating? In what context is this evidence being generated? What's the client preference? And when we say clients, we're talking about our patient. What's their judgment? And you will see how it starts from the discuss, the experience, the research. And it's really about the research that I want to talk about today, and experience is part of it, as nurses, as bedside nurses, for example, what experiences are we seeing with our patients? How can we translate that into research? How can we translate that into moving the knowledge forward in clinical research? And just going further ahead in the slide, I also put here a triangle of what's called the levels of evidence, starting from what's supposed to be the gold standard to just beginning to even scratch the surface of things. And you would see at the bottom of the triangle is, we have the level 8, which is non-research source, like internal evidence. For example, what did you see with your patients today? Are you taking care of a patient today in your medical surgical ward, and there's something that is interesting to you that you think perhaps if we know a little bit more about this is something that I've been seeing in a lot of my patients, that if we further investigate this could turn into a body, a evidence generating clinical trial. Oh, someone said they can't really get what I'm saying. Does that mean my projection is not coming well? I acknowledge that message, but I would move on. But definitely, I can come back to that question. Um, Also, there's the qualitative study and descriptive study. There's systematic review, non-expert. Oh, projection is clear. Okay, thank you. Non-experiment. Well, someone said not really. Perhaps we want to turn our mics up a little bit just so you can hear me more. But Dr. C, can you hear me clearly?
Yeah, I can hear you.
Okay. All right. So I would go ahead. Um,
You.
and I believe this is also recorded. So perhaps we can also reference back to this. And talking about level 4 is non-experimental study up all the way to systematic review or meta-analysis. I would say that what I probably did in my bachelor's degree was more of a level 7, level 8, meaning it's not really the highest level of evidence. And in order for us to be at that top 4 level of evidence, it requires us to truly understand what clinical research is. How can we conduct a thorough, a rigorous clinical research? And I'm not talking about the fact that we can or we should always conduct an experimental study, right? Because experimental study requires a lot of time. It requires a lot of resources to, which I acknowledge. But the goal here is not just to have everybody just conducting clinical trials or large scale clinical trials. That's what the pharmaceutical companies would usually do. But in order to ensure that our work, our knowledge, our expertise is contributing, we need to start from conducting rigorous clinical trial. And I'm sorry to bust your bubble, that knowledge, attitude, and practice is not one of those, particularly in areas where we already, I mean, we know the knowledge and, knowledge, attitude, practices of nurses education. Yes, we know that. There's no new knowledge to have, to discuss right now. It's about how can we take it a step forward? How can we take it a notch upwards? And if we go on to the next slide, I see Dr. C just smiling there. I hope I didn't rub anyone's feather by saying knowledge, attitude, and practice is not really evidence-based generating research. But I want to make sure that when we're thinking about our thesis, the first thing is we want to make sure we're starting with a good research question. For us, what about knowledge, attitude, and perceptions?
Please unmute yourself.
Oh, have I been on mute all this while? Okay, all right. So in terms of knowledge, attitude, practice, I never published mine. I mean, I don't know if Dr. C ever published his own. Did you ever publish yours? You published yours? Your knowledge, attitude, and practice?
Yeah, I did.
You are on mute.
Can you hear me now?
You're still on mute. Oh, you published yours? Well, is there anyone else on the call that has published their knowledge, attitude, practice? And Dr. C, what journal did you publish that in? And I'm talking about your bachelor's degree.
Okay, can you hear me now?
I still cannot hear you. I'm not sure why, but maybe if you unmute everyone, it might be helpful, and that way you can talk. I can hear you. But definitely, if you're not talking, can you? I mean, I don't
Can you hear
hear the
me?
background noise from over here, so I'm not sure if everybody else can. Okay, all right, definitely we can move on. But really, the point of saying that is to make sure that when we're identifying our research questions, that they're rigorous. It's not just something that somebody else has already done, but you really want to partake. How am I adding to the body of knowledge? And here are some things that I think are criteria for developing good research questions, starting with your interest. We all have that research interest that we have. We all have that, for example, myself, I'm interested in critical care medicine. I'm interested in hematology, clinical research, and maybe just general medicine research in general. That's my research interest. Yours might be different, and our research interests are usually formed by a personal experience, either with patient care. It could also be formed based on our background, what we've experienced in our personal lives and not just in our patient lives. And then the second thing you want to consider is my research question feasible? Meaning the number of subjects that I'm trying to get to. Am I going to be able to get the number of subjects? Do I have the resource? Do I have the time, the money? Do I have the experts? And even if you're not the expert in your research interest, do you have access to experts that can mentor you? For example, if you're interested in nursing theories, you might want to reach out to people like, when Nosology Academy brings on the theorists that are coming in the next two meetings, you might want to reach out to them so those are people that can guide you. So you have access to the experts because it's not going to be feasible or attainable if you do not have all of these things that it's required for you to actually conduct the study. The next thing you want to think about, with regards to your research question is my question novel? Is it going to generate new finding? And really what you're looking at is you can either be confirming what we already know, what's already in the body of knowledge. You could decide that you have evidence or you have experience that you think is enough to refute what is currently in the body of knowledge. You can challenge what's in the body of knowledge currently. Or you can be thinking about questions that extend our understanding about a particular condition, about a particular phenomenon, about a particular experience of patients in your research interest space. You also want to consider, is it ethical, or do you have IRB approval? Is it ethical in the sense of the patients or their data that you will be including are you looking at it from an ethical point of view? Are you going to be able to say, yes, this is repeatable? The next thing is the relevance. And I think that's really important, just as the rest of them. What is going to be, when you answer your research question, what will the impact be on the scientific knowledge? Does it have the potential to influence the direction of future research? Or even does it have the potential to influence how we are currently caring for patients as nurses? Does that change the way that we will be caring for our patients in a way that it's either in the sense of efficiency or effectiveness? These are criteria you want to make sure they are thinking through as you're formulating your research question. And going on to the next slide. Any question on this particular slide before I move on? Okay, maybe not yet. And here is just what I've put together as what's considered a research process. Again, knowing that we will not all be conducting experimental studies, we also want to make sure that either our secondary data analysis, for example, our observational study, qualitative, mixed method studies, that they are following the right process. And building back on creating a good research question, you start with your purpose. What's your aim for answering this question? And really, then you move on to your research question. And this requires rigorous activities, starting with what do we currently know right now about your research topic? And that should send you to creating your literature review, right? Because even though you're not an expert, consulting what the literature currently has about what you're about to do to make sure that you're not repeating what somebody already has done. You're not just putting your effort into what would not be fruitful or what would not move the knowledge forward. You want to make sure you conduct a thorough background and literature review of what's currently in the body of literature. That way you can identify what's missing, what's the gap, and that's how you develop your research questions. You also go on into creating your assumptions, because the essence of you publishing it is to make sure that whoever picks up your research or picks up what you've published can repeat the same thing within the boundaries of your assumptions. You also want to make sure that you're picking the sample methodologies that truly reflect or answers your question. For example, if your question is, what are the lived experiences of patients living with cancer? This will not be through a survey, right? Because your question will be limited to yes, no, not little, too little, medium, high. No, you want to make sure you're conducting a thorough qualitative study where you're actually either doing a group interview or you're interviewing one-on-one with patients, of course, with questions built on what you found in the literature and what you identified as your gap. Your data collection method will also be tailored to what your research questions are. For your data collection method, again, going back to the lived experiences, in as much as your demographic would be more quantitative, your data collection methods, just sending out questions and not actually meeting with those patients that are living through the experiences that you want to know about, might not be the best data collection method. And obviously your research methodology. Are you looking at it from a qualitative perspective? Are you looking at it from a quantitative? Or do you even want to do a mixed methodology which combines qualitative and quantitative? You also want to make sure that you're going through what your quality criteria is. A lot of this you can infer from what you've gathered from your background, what is considered quality. Because when you are preparing your data analysis too, you want to make sure that you're looking at the most relevant data quality perspective in terms of your data analysis. For example, if you're conducting a quantitative research, a mean median mode is not the only way you can go. I mean, that Honestly, that does not really add much because your data analysis for a quantitative research, you should be looking at a robust statistical methodology of how you're going to analyze your data, particularly with reference to confidence intervals, margin of error. Those are things you need to consider because those are things that whoever is reviewing your submission to the journals would be looking at to make sure that truly you went through the rigorous activities that it requires to publish this body of knowledge. And finally, report writing. You can do all of this work, but if you don't have high quality writing, or if you are not publishing or targeting dissemination of your work into high quality journals, you really need to make sure that all of your efforts are going into writing. The purpose of writing appropriately and targeting journals that address your research interest is to make sure that the experts in the field can see the work and what you're contributing to the body of knowledge. That's how you can be a key opinion leader in that particular research interest area of yours. And honestly, while this might be the rudimentary research process, I am happy to go into details with anyone that has questions. But these are kind of the fundamentals that you need to go through to really produce a resounding and really a high quality research. Again, this doesn't always have to be experimental. You could even be doing a secondary data analysis and you're going through all of this process and quality, and you can publish those too. Just if you have access to like registries that have your questions that you're looking at. But these processes are definitely a starting point to both generating great research questions, but also making sure that we're moving the body of knowledge forward with your contribution. Going to the next slide. Any questions so far? I'm not really looking at the chat, so if there is any question, please feel free. And also, I wanted to quickly touch base on protocol. I don't know how familiar we are with protocols, but a research protocol is really a diary of what we did, and this usually is what translates into what you submit into your journal. What did we do during this research? For example, you start with your title page. A lot of them might require you, particularly once you've gone through the process of your research questions, you've generated all of the evidence that we've been talking about, and you're about to publish it. Your protocol is really a guide that if I were to see your journal, say, for example, you conducted your research in Nigeria and I'm in another African country, I can pick up your body of protocol and be able to follow step by step to replicate the same thing that you did in your population. So this is really a good start too for if you're thinking about your PhD programs, or even, for example, if you're thinking about applying for scholarships to fund your research or to fund advancement of your research. Typically, you'll be expected to have this protocol, and these are typical components that should be included that tells them you've gone through the process, you understand what it takes, and you are ready to do this work. Starting with the title page, the background information, all the way into the process of the conduct of the study itself. How did you implement it? How did you monitor your data to make sure that there's little to minimal error in the data that you were gathering, knowing fully well that there is room for boundaries. That's where your confidence interval comes from. But for example, your study procedure and schedules gives me exactly how you did your study and protocol. Going to the next slide, and I think this might be maybe the last or the second to the last. And just, I know I've talked so much about, contributing to the body of knowledge. I'm sure some might have questions with regards to where do we get these trainings? How about the resources? Your first place will be your CT and GCP training. For those of you in your PhD program, I'm sure this might probably be a requirement for you to even go on into starting with your research, or even going to patients to enroll them in your studies. But yes, your CT and GCP is a good start on the good clinical on how to conduct and follow good clinical practice guidelines. Your IATA training might also be important, particularly if you will be working with, say, for example, blood specimen. You'll be doing analysis of, say, for example, like saliva. These are trainings that you need to have as you're transporting from one place to the other. And for example, if you have a biomedical student on this call that is interested in what are the assays that are different, in terms of the blood profile of Nigerians, for example, for a particular disease condition, this is something, this is a training you want to make sure you have. And last and not the least is research associations and networking. These are places that you can either talk to people to mentor you, to support your clinical research work. So, SOCRA is one of them. ACRP is another one. I'm a member of ACRP CP. That's also a place. And there are also a ton of resource and training on ACRP and SOCRA's websites that can also help. Some are targeted, which could pique your interest depending on what your research interest is. I think this should be the last slide. But if there is any questions so far, right, I think that's the last slide. Right, and this I just kind of put it there just for those that really want to go through that processes that I laid out, or the processes for identifying your research question. I said you started with your literature review, find the all in it. What's the literature on your topic? What's the literature on your topic's method that people currently know right now? That's how you find a good research question. That should be your foundation, not just because, oh, this person is doing this, this is their research question, I can just piggyback on them. No, you need to consult the literature. That's where you have a consolidation of what we currently know in that topic, in that methodology. And you find it all in there. It's almost like you see a paper and you want to shred it apart and see what didn't they do right that could have an impact on how we can interpret this data. And that's what I'm going to be going on with my research question, the whys and the hows. Also your methodology, what's the research design? What would your procedure look like? What kind of data are you going to be collecting, and how are you going to be collecting this data? And obviously you want to go to your preliminary data. What's your evidence of importance? Does this inform how you conduct your study in the next step? What's the preliminary findings? For example, does race, does ethnicity, does gender, does even age have a role to play in what your research interest is, or the topic that you're trying to explore on? Does that have anything to do with that? What are the importance categories in relationship? I see a question, and then question in terms of limitation. Like I said, going back to what your assumptions were and what the limitations were when you were conducting the study, which statement of limitation for other studies might be the first place that you want to look out for on what other research question can you generate from them. Say, for example, if their limitation was geographical, are you thinking about recruiting your own patient in another geographical area to see if the results are still the same? And if the results are not the same, of course you're contributing something to help us understand that your lived experiences, for example, your geographical location might have an impact on how you relate or how you respond to a particular condition or phenomenon, for example. That's the end of my slide. So I would say, Dr. C, if you go through any of the questions, please read them out to me, and I am happy to answer questions. It'll be nice to see more faces up here, but totally fine, understanding that this is probably at the end of the day for most of us.
Yeah, thank you very much for your presentation.
My questions.
Can you hear me?
I see me look to the right.
Yes,
It has
sir.
nothing to do with you. I'm just trying to see if I can read through the questions as well.
All right. Can you hear me?
Dr. C, if you want to unmute yourself so that I can hear the questions. I can't really, thank you so much. I can't really hear you speak. I can see your mouth move, but I can't hear you.
Can you hear me now?
So I'm just picking the ones I can see right now. And thank you so much for being interactive. I see a lot of questions in there. But one question that I'm seeing right now says, thank you for the presentation. Please, how do you go about choosing a research topic? I think first it starts with your interest. If we go back to that slide, we don't have to go back to it right now, but the slide where I talked about criteria for good research question, that's your first place. What are you interested in, right? That's where you start from. What is your interest? If you're a bedside nurse, for example, right now, what are you most familiar with? What piques your interest? That's where you start. And then you start going into, in my research interest, what is the literature currently saying right now? and what is not being said, what is not known right now that I can think about to form my research question and go off of that. So that's how you will start. Someone else said, can you give example of evidence-based generating research? I probably don't understand that question, but if it's what I'm thinking, like what do you consider evidence-based? As long as you are saying, or your body, your clinical research or even your research is telling us what we currently don't know, that's evidence generating. And like I said earlier on at the start, it doesn't always have to be an experimental study. Of course, that's one of the highest standard randomized clinical trials, is one of the highest standard level of evidence-based generating. But there are other ways that we can further understand how people interact, how people react, for example, what people's knowledge is, and I'm not talking about knowledge, attitude, and practice, people's understanding, for example. That's as long as it's something that is not currently in the literature and you are going on that journey, and as long as it's of relevance to what is required or what we know right now, then you're contributing. That's evidence-based generating. And as long as it's robust as much as possible, you want to enroll as many subjects as possible. And if you're looking at secondary data analysis, you want to make sure that you're not doing a high level statistical level on just 10 data points, because no, that would not be robust enough to say, yes, this is evidence. Someone said, who is this? Like myself? My name is Ronke Awojodu, if that helps. Thank you for the positive comment. Well, Dr. C has the slides. Oh, you said you need more? Sure. Well, I think I see Allah Mustafa with hands up.
Yeah, I think he can unmute
Possibly
himself.
if probably has a question.
All right. Hi, good afternoon.
Okay, go ahead.
Yeah,
I think you're on
thank
mute
you,
now.
Ronke, for that. Can you hear me now? Can anybody hear me?
Oh, wait, is this Allah Mustafa, like our classmate?
Yeah.
Hi. Good to see you.
Okay, good to see you. How are you
Why
doing?
can't I hear? There's something wrong.
Okay.
You should be able to hear me now. Can you hear me now? Hello?
Here. Is there?
I can hear you.
Can you hear him, Dr. C? Because I might be the problem.
Yeah, I can hear you.
Oh. I
think
don't
it's
know
your
why I
audio or
can't
something.
hear anyone.
Maybe I'll have to log out and join back. I can't hear you. No, it's not your problem, Mustafa. It's not
Is your volume all the way up, though, Dr. C?
Yeah, I
Because
can
I
hear you loud
cannot
and clear.
hear you. Oh.
Okay, can you hear me? Can
Or you
anybody
can
hear me? I
type
can't hear anybody.
question or comment in the chat.
Go ahead.
You're on mute again, Dr. C.
Yeah. Can you hear me now?
We can hear you, sir.
We can hear you, sir.
We can hear you, sir.
Can you hear me?
I can hear you.
Yes, I can hear you.
No, we can't hear the presenter.
Yeah, for some reason, I can't hear what everybody else is saying.
I think there's a problem with your computer or something. We can hear everyone.
Yes, if you can type the questions for me, Dr. C, I think that would be great. Because I want to make sure in the next couple of minutes that I'm able to answer as many questions as possible. Thank you for the time. In the research process, step 7 is quality criteria. Can you give
detailed explanation on those criteria. So what will be considered quality? For example, you also want to make sure that your work is ethical. Also quality in terms of how you're conducting your trial, well, maybe not clinical trial per se, but how you're conducting your research. You want to make sure that if you set out to do a mixed methodology, that's actually what you're doing. If you set out to collect 10 data points per subject, per patient, you want to make sure that that's what you're doing, that you're not cutting corners, right? Because those are the things that when you submit your work to a journal, those are the things they'll be looking at. Is it repeatable? Is your research repeatable? That's the first thing that comes to every reviewer's mind. If I look at it and I'm like, well, we're not really clear in your process, we're not really clear in your procedure, how can we be sure that this is actually repeatable? Because it's only when it's repeatable, the same evidence being repeated in different population or in different environmental situations, can we tell that, yes, that's a fact or that's evidence-based per se, but it's a collection, right? It's a collection of different research from different components that leads up to that. So that's kind of where your quality will be coming from. How does quality research really translate to quality healthcare? Well, quality research, so for example, like I said, the evidence-based generating, right? If we have quality research, then we can trust the data that we're getting from it. We can trust what the data is telling us. And that's what feeds into the practices and guidelines that are being rolled out for how we take care of patients. For example, what was the guideline for taking care of hypertensive patients 10 years ago is different from what it is right now. Not because some people just sat down and thought, well, yeah, let's just change it. No, they looked at what the literature was telling them as best practice. And based off the evidence that they have in the literature, they decided, well, we have overwhelming evidence to show that perhaps our practice 10 years ago is no more relevant right now. And as such, what is relevant right now is what should be the guidelines that we should be following. And that's how that translates into quality healthcare. Because if we are practicing in a way that is in line with where the literature is right now or what the evidence is pointing to, then we can expect better outcomes in our patients. Why should nurses be concerned about research when we have limited scope of practice in Nigeria? I do acknowledge that, but I will also tell you that even in other developed countries, no particular profession has an overwhelming overall highest scope of practice. I do understand the limitations in Nigeria. However, we should be involved in research because we are closest to the patient as nurses, right? You understand perspective that would generally not be shown on the medical records of the patient, right? You would understand what their family situation is. For example, if you require a patient to come in twice a week for a particular treatment, yes, the doctor might look at them as, well, they didn't show up and they're a no-show. But with your communication with the patient, you might be able to tell, well, they have a child in school, or they have a child that is sick too. How do you expect them to come for that care? And then we start thinking about how can we take the care to meet them where they are. But nurses' voices is definitely paramount because we are the closest to patients. I don't want us to limit ourselves to thinking, well, I just have a limited scope, well, whatever they tell me to do is what I do. No. Jean, for example, Jean Piaget did not get to that position by just sitting down and being, a bystander, just doing whatever everybody else tells them to do. But you have that unique perspective that other professionals might not have in the healthcare setting. So I hope that answers that question. Someone said, do you mean validity and reliability as quality criteria? Yes, those are some quality criteria that you can look at because validity and the reliability is making sure that the instruments that you're using gives you the results that you intended, not the result that you intended to give you, but really what you were looking to find. For example, if you're looking to find, does this particular medication give this response? Is your testing instrument reliable? Rather than asking the patient, well, did this make an impact on you? Yes or no? Yes, that's a valid one too. But is it truly reliable, right? Because that would change from patient to patient. However, if, for example, you're looking at Are we going to see a trace of this of this medication in your blood? What level is it going to be like at the 3rd week of you taking this medication? That's more reliable than just asking, did you feel better after taking this medication? Yes or no? That's not as reliable as, well, we're going to do a blood draw and we'll see where the level is. What's the trough of this medication, right? That's more reliable. Someone said, can you recap on the criteria for choosing clinical studies? What do you mean choosing clinical studies? If you want to unmute yourself to speak more to that, I think that's fine, but choosing clinical studies in what sense?
No, I don't know if you can hear me.
Yeah, we can hear you. Go ahead.
Okay, all right. Okay, so it was in one of your presentation, and that was before the presentation.
There was a question back up earlier on that said accessibility to healthcare is highly challenging due to poverty and ability to get to healthcare facility in good time. Yes, and I said it at the beginning of this presentation, saying we will work on what we as students, as professors, can change. For example, bad roads, definitely. The poverty is there. Do I, Ronke, have power over that? No, I do not. But that's the unique situation of Nigeria and other countries. And there are other things that are unique to other countries too. So yes, accessibility might be a challenge, but if we as institutions and students are proven that we have what it takes to run clinical trials, that we have the capability, we have the capacity, we have the knowledge, the experience based off all the generating evidences that might not be clinical trials or experimental studies, that is a way to attract pharmaceutical companies, for example, to want to come in and conduct clinical trials, because one, we can afford them the diversity that everyone is looking for, right? We can afford them other perspective that they might currently not have access to, particularly for diseases that are common in all countries. And that could be a way to invest in our healthcare system, but also a way for patients to have access to healthcare that they would generally not be able to afford or would otherwise not have access to. Let me go back to, I think you were trying to clarify. He's trying to clarify screening criteria for choosing slide before clinical process. Kindly recap. Do you want to go back to that slide before research process so I can recap? How do one generate good research questions? I don't know if this person is just joining, but we have this slide on criteria for good research questions. So I think just to summarize this is saying that you need to think about your research questions based off what the literature is telling you, not just based off, well, I saw this topic, this sounds fascinating, let's go ahead and do it. No, what you answering that question, what will it generate to the body of knowledge? That's really what's paramount. Is it novel, right? Is it ethical in terms of how you want to conduct the study? Is it feasible, right? The number of subjects that you're aiming to go for, is that feasible? Do you have access to that patient population? For example, if you want to, for example, conduct a research on hypertensive patients, right? Do you have access to hypertensive patients? And I think because we're all in research institutions that are either affiliated with teaching hospitals or have their own teaching hospitals, yes, we probably would have access to the required patient population of our topic of interest, right? But you want to think about all of these things, is how I'm recapping it in what is the gap in the literature right now about your topic of interest. And your questions should be based off, I want to address the gap with these questions. Please, can you explain the importance of collaboration? But, let me go to the questions. Please, can you explain the importance of collaboration in nursing research? Oh my, yes. we are not islands by ourselves, right? So it is important that we collaborate, because even though nurses are the closest to the patient, we work in an ecosystem. We work in an interprofessional healthcare system where you have the nurses, you have doctors, you have your biomedical team, right? You have your lab team, because those are people that are running your blood samples for you, right? You also have the CNAs, as it might be in the context of Nigeria. So it is important that we're collaborating with everyone, right? Because we want buy-in from everyone. We're all going to be utilizing this evidence to take care of our patients. And it's important that all parties to the healthcare system have a say and have buy-in. So it's important to really like collaborate. You can't just go solo by yourself and go do things. Even if you're looking at topics that specifically just relates to nursing practice, you still want to make sure that you're thinking about how your job, your role as a nurse interrelate with every other profession in the healthcare system. I see that we're about to conclude, so I'll stop talking for now. But it's really been a great pleasure talking to everyone. And please feel free, I'm on LinkedIn, reach out to me with questions if needed, or let Dr. C know. I'm here most of the time. So thank you so much for joining.
All right. Thank you so much, Ronke. That was a very lovely one. We appreciate your expertise and also appreciate your presentation. All right. She told me a few days ago that she'll be available to take all your questions in case you have any specific questions regarding your research. She should be able to help. If you need some, if you need to consult with her regarding some specific issues, she would not be able to be your full supervisor, take over all your work, but she can give some technical advice regarding your work. So you can reach her via LinkedIn, or just let me know if you need any specific help from her. But generally, we want to appreciate you greatly. You've been of a good resource to us. You were able to dissect everything about research and clinical research and how nurses can really collaborate. I'm sure the students and the professors who are here have really, achieved one or two things. We've learned one or two things, especially how we can go further to advance our research perspectives and also improve, healthcare generally in Nigeria. So we have about 75 people. Okay, 70 people now. We were 75 at the time. So by the time these 75 people go out there and also tell others what they've learned, and I know over time we'll be able to, change our research focus and research perspectives for, a positive outcome, and eventually it should bring about improvement in our healthcare systems. Nurses, gone are those days when we were doing just knowledge, attitude, and practice research. Nurses are doing real researches that are bringing solutions to healthcare. There are innovations when you go abroad or go to other, Western world. There are innovations that actually emerged from nursing researches, and that is what we want our Nigerian nurses to start imbibing, into our research practices. Not just to fulfill all requirements for a program or a degree, but let us have the mindset that we want to bring an improvement to the healthcare system and also improvement in patient outcome. So this is the end of our presentation today. We really want to thank everybody who participated, who attended this program. Even though it was in short notice, but I'm really overwhelmed. It's really overwhelming to see the number of people that really turned up. And then our presenter, thank you so much. I know you are very busy. You are extremely busy, but thank you for obliging us, by coming to present. Thank you so much, and we hope to invite you some other time, and we hope you'll be available to share more to each and every one of us. Yeah, and people, I know the people on the platform, they're also, I'm sharing their sentiment. They're also appreciating you the same way. So many people are sending their messages on the chat. Yeah, can see them appreciating you. So thank you so much, and enjoy the remaining part of the day. So are there any final
Thank you,
comments
sir.
or final word before I end the meeting? You can just type anything on the chat so that we know if we really conveyed your sentiments.
Somebody
Okay.
Obi for us.
This is Simolomi. What did you say?
I said somebody is playing music for us.
Well,
Don't know how
that's
to use it.
by the way. Okay, thank you so much, everybody. And I hope you all will join next time when we invite you. The goal is just for us to improve our research practices in Nigeria. We are not paying, we didn't pay Ronke a dime because she's passionate about improving our healthcare system in Nigeria. I didn't give her any kobo, but she decided to give us, this loaded research. So all of us, let us also have the mindset that the goal is to advance our nursing practice in Nigeria and also, globally, and for us to become competitive. For us to, some of us have applied to, PhD programs. We have not been accepted because of research deficiencies. These are the reasons why we need to, improve ourselves for us to be able to compete. So that when people see our work, they should be able to say, well, this is quality work and we have actually done, our best. Not when they hear that this person graduated from Nigeria, they have this sentiment that our work has been, our work is, it lacks quality. So this is the essence of all the things we are doing here for us to really advance, for us to improve whatever we are doing to advance our, our nursing research and clinical practice. All right, thank you so much, everybody. Please join us on our Facebook platform, Nursology Academy, on LinkedIn, on Instagram. More programs will be, presented very soon. And I hope you all will participate in upcoming programs. Thank you very much and have a blessed evening. Those in Nigeria and Ronke, enjoy the many parts of the day.
Thank you, sir.
Thank you, sir.
Thank you.
We appreciate you, sir.
Thank you, sir.
Thank you, sir. Thank you. You make my day.
Thank you, sir. Thank you.
Thank you so
Thank you,
much.
sir.
Thank you so much, sir. God bless you, sir. God bless you, man.
Thank you, Professor.
Thank you, sir.
Thank you,
Sir, thank you, Ronke.
Yeah, even
Thank you, sir. Thank you, sir.
yeah.
Thank
We
you,
hope to
sir.
collaborate more. We hope to continue to work more.
Thank you, sir. I'm
Yeah,
greeting you
thank
from
you,
Shaki, Nigeria,
doctor.
sir.
Mr. Damola, well done.
Thank you,
Sir,
doctor.
well done, sir.
Family.
Well done, sir.
We'll see next week by God's grace. We'll be inviting Dr. Jim Watson. We'll be inviting Dr. Jim Watson. Dr. Jim Watson.
Thank you, sir.
Thank you. We are going to invite Jim Watson. He is a renowned theorist. He's going to tell us how we apply our theory into our clinical, our nursing, Nigerian context. So I hope you guys will be available, on the 23rd of March to meet with Dr. Jim Watson, the nurse theorist, one-on-one. If you have any questions,
Thank you.
send message. Is that what?
Thank you, sir. Thank you, sir. Thank you, sir.
We love to see the one, sir.
Thank you, sir.
Okay.
Thank you, sir. Thank you, ma'am.
Please
Thank
join
you,
our
sir. Thank you, sir.
platforms,
Thank you,
join
sir.
our Facebook platforms and all our social media platforms, even on
Hello.
LinkedIn. Join so that we can always collaborate in different research endeavors. All right, thank you all, and God bless you.
Rest.